This is a video on how to administer sub-Q fluids to your pet. Fluid bags typically look like this, and then they will have numbers on the side going to 9. Each number is 100. So if your pet's getting 100 mLs of sub-Q fluids, you would bring it from the 1 down to the 2. Say if they're getting 50 mLs, you would go in between those two numbers, and so on. A fluid bag typically lasts for a while, and then we have a venous set to go along with that. These typically only need to be changed when you get a new bag. The venous set looks like this. It's just a cord that will connect the fluid bag to your pet. It has 2 clamps on it. We don't use the white clamp very often, but it is something that you're able to use to clamp off the fluids and release the clamp. Otherwise, there is an L-shaped one here. When the clamp is forwards, that means that the fluid is flowing, and when it is pulled towards the bottom, then it's going to be stopped. So in order to hook up the venous set to your fluid bag, there are ports at the end of the fluid bag that you would remove the tabs from. And then there is a cap on the top of the venous set here. This side is sharp, so make sure that you're careful with that. We do want these two to stay as sterile as possible, so try not to touch either of these things to anything else. We don't want to introduce bacteria. So you would insert the venous set into the bag, and then you flip that up, and our fluid line is clamped right now, so it is not flowing. If we were to unclamp that, it would start to flow here. We want to have a little bit of fluid in this bottom part here to prevent any bubbles in the line. Once you have fluid in this here, you want to make sure that you run it through your line fully so that there are no bubbles in the line. If there are a couple, that's okay. When it's going under the skin, it's not quite as big of a deal, but you don't want any big ones, so just the little ones would be all right. So once you have your venous set hooked up to your fluid bag and you have opened the line to let the fluid run through and get rid of all those bubbles, then you just add a needle onto the bottom. So there's a little cap on this end as well. You just remove that. You don't want this to touch anything else either, because that's going to be connected to your pet. So we don't want that getting dirty or having bacteria. Same thing with the end of the needle. So then you would just take your needle, add it on to the end, it screws right on, and then you're all set to administer. Needles should be changed after every administration. So you can leave the needle on here, but make sure that you change it before you give your next set of fluids. And otherwise, we will have another video here showing you how to administer to a patient. So we'll show you how to insert the needle for subcutaneous fluids. First, you start with your pet, and you're going to go kind of between the shoulders. You can do either shoulder if you're administering fluids at significant intervals. If you're doing it multiple times a week, sometimes you can move it around a little bit so it don't get sore. But typically it goes between the shoulders. So you would start by picking up the tent of the skin. So you pinch on the shoulder blades, and then you pick up. It's going to make kind of a little triangle right here, and then there's going to be a hole right in between where your fingers are, and that's where the needle's going to go. So then pinch, pull upwards, triangle here, and then you would uncap your needle and insert it into this area here. It would sit something like this. And then from that point, you just unclamp your fluids, and then it will start to flow. There will be a bubble that will sort of form under their skin. That's normal, that's just the fluid gathering under there. And then once you're all done with the fluid administration, you place your finger sort of over the needle. You don't need to put your finger directly onto it just yet. You pull out the needle and then you just hold that spot for about a minute. Sometimes they will leak a little bit afterwards. That's totally normal, just the hole from where the needle was. So I'd say after about a minute, they usually tend to seal up pretty good. If there is a little bit of leakage, you just clean that up, and then most of it should stay under the skin though. And then after they're all done being held off, then they're good to go and you're all done.